Hi, I'm Mariam Azmi. Diabetes is a life-threatening condition affecting more than 3.5 million Malaysians. It is a major risk factor for cardiovascular diseases. People who have diabetes are more likely to develop heart disease and have a greater chance of heart attack or stroke. In today's Heart News, we will uncover how heart disease is developed and what you can do to help reduce the risk of heart disease. Diabetes is a chronic disease that can be managed by monitoring your glucose levels. But what many people don't know is that two of the most harmful complications of diabetes are heart disease and stroke. People with diabetes are also more likely to have certain conditions or risk factors such as high blood pressure or high cholesterol.
Okay, heart disease and stroke are pretty much the same condition, except that the organ is different. The organ is, one is the heart and the other one is the brain. So pathology wise is the same. The process is the same because it is an interruption of blood supply to the organs. If you interrupt the blood supply to the heart, it becomes a heart attack. If you interrupt the blood supply to the brain, it becomes a stroke. So the interruption of blood supply in this case is because of blockage of the vessels. So the link between diabetes and heart attack as well as stroke is that diabetes predisposes the development of these plaques, and these plaques can develop over many years. You must have a healthy lifestyle, and that can only come from early avoidance of diabetes.
Patients with diabetes mellitus or type 2 diabetes have more than 2 times the risk for developing heart failure, and those with heart failure are at higher risk of developing diabetes. In IGN, Diabetes Lifestyle Clinic was built for people with diabetes and at risk for cardiovascular disease. This clinic will be staffed by trained diabetes educators who will guide and support diabetic patients from start to the end so they can live full and productive lives.
The objective of IGN setting up this Diabetes Lifestyle Clinic is because we understand living with diabetes is not easy at all. Therefore, in IGN, we are trying to manage to support people with diabetes to manage their diabetes well. Our trained diabetes care team will actually give the patient the information and guidance that they needed to effectively cope with the diabetes condition. So this is what actually our aim into having this Diabetes Lifestyle Clinic, to actually work together with our patients so that they're able to adapting a healthy lifestyle, and also they know how to cope and how to look after themselves with these conditions.
IGN plans to lead cardiovascular risk control among diabetes patients as their main goal. Being at the forefront combating heart disease, IGN will find ways to mitigate the impact diabetes has on cardiovascular disease and improve the health of the country as a whole. I'm Mariam Azmi. Thank you for watching, and don't forget to subscribe.